Now we're going to do the respirations on a neonate. Respirations definitely can be difficult. So we're going to show you a way to do it that will increase your level of satisfactorily doing the respirations. So the equipment you're going to need again is a stethoscope, an alcohol wipe, and some type of timer device. We like to use the thermometer in the hospital, as it always has a timer on it for you. So the first thing you're going to want to do, of course, we want to keep our baby warm, but we're going to need to be able to see the abdomen. So Jenny is going to keep the baby wrapped but expose the abdomen. So your babies, they don't like it when the cold air hits them, so they start to squirm just a little bit. Okay, so now you can see the abdomen. They're abdominal breathers, so you'll be able to actually see the respirations, but these respirations can be so shallow that you may not be able to see it. So that's why we're going to use a three-prong approach. So the first thing Jenny is going to do, she's going to clean her stethoscope, and she is going to put her stethoscope on, and she is going to put the diaphragm near the trachea on the right side, far away from the heart. This will help us to hear audible breaths. Next thing, Jenny's going to take her hand and put on the baby's abdomen so she can actually feel the respirations. And then the third thing she's going to do is look at the abdominal breathing. So this will give Jenny an idea of the respirations. I know that many nurses you'll see will only watch, but sometimes you can miss some respirations that way. So we would like for you to use the three-prong approach by listening, palpating, and inspection of the respirations. And you're going to watch for 1 full minute. Where people sometimes have difficulty here is when the baby starts crying. The good thing to know is that every cry is 1 respiration. So you just count through that. So it's actually easier to count respirations when a baby is crying. So now, Jenny, we're going to finish up doing our respirations, and we're going to pretend like the respirations, the normal respiratory rate is 40 to 60. Sometimes when they're sleeping, they can creep down into the 30s, but they should not be in the 30s all the time. So we're going to say that Jenny has now just finished her respiration. She did it for 1 full minute, and she got a respiratory rate of 55. The baby's color looks good. The baby's nice and pink. There's no respiratory distress. There's no grunting, retracting, or nasal flaring. Grunting, audible sounds, retractions, pulling of the abdominal muscles to gain air, and then nasal flaring, flaring of the nares to increase the diameter of airflow going through the nose. So now Jenny will, so she got a nice respiratory rate, and she will now rewrap her baby so that our baby stays nice and warm. We definitely do not want our baby to suffer the consequences of cold stress. Thank you, Jenny.